There have been suicide prevention interventions for a long time here in the U.S. Back since the 1950s, there were suicide crisis lines and prevention lines, the first one starting in the 50s in Los Angeles. So more recently, we've really been thinking about, we being the United States, and the states and localities have been doing this to different degrees for a while, but really thinking about like a continuum of what we call crisis care, right? And we can think of there being three main pillars to crisis care. One we can think of as someone to talk to, and that's where these crisis lines come in. Another one is someone to respond. And here we have something called mobile crisis response teams. So often these are alternatives to the police, right? So historically, if a loved one was thought to be suicidal or struggling or having a mental health crisis, somebody was called 911, the police come, right? Police officers can do a good job responding to that, but it's not necessarily they're trained to do that, right? A better model may be to have a trained mental health professional be the one that responds. So there are these things called mobile crisis response teams that are deployed sometimes when someone's having a mental health crisis, which is thought to be a better response. So someone to go to folks in the community who are experiencing mental health crises. And the third pillar is somewhere to go, right? So here we have things called crisis stabilization centers. So these aren't, this isn't a hospitalization. This is like a 24-hour or less place where people can go when they're experiencing a mental health crisis to be safe. There's a psychiatrist there, counselors there, and kind of help them in that period of acute crisis and connect them to what they need next to help them recover and help them get what they need. So more and more in the U.S., there are crisis response systems, and I emphasize the word system, where we have these three entities working together in a concert fashion.